The healthcare debate in Washington is being driven by the access problem. I think there are two aspects to healthcare problems. One is the expense, and one is access. We don't have perfect access to elective care. They say there are 46 million people without insurance. But the interesting thing about it is, of those 46 million, doesn't mean they don't have access to health care. It means they've got to pay cash for their health care. They don't have health insurance. But the question is, you look at the 46 million, you have to ask yourself, who are they and how would we fix the problem? A third of them are eligible for Medicaid and haven't signed up. Why don't they sign up? Because we have 100% access in the emergency room. They've got a cold, they can show up in the emergency room. They clog up the emergency room, but they have access. And they're not bothering to sign up for a government program that already exists. A third of them make more than $50,000 a year, and they're not buying insurance because of the expense. So they're not really part of the access part of the problem. They're part of the expense part. They're not buying it because it's expensive. They make more than $50,000 a year, probably they do pay most of the time when they go to the doctor. Their problem is if they have a catastrophe, they have no insurance. 20% of the 46 million have come into this country illegally. And I don't think we should drive the debate for giving and making this security net larger by people who broke the law to come into our country. A third of the 46 million also are without insurance for less than a year. They're young people. They're getting their first job out of college or high school. They're in between their first and their second job, and they get insurance within a year. So I think they've made this 46 million this overwhelming thing, and it's like nobody's talking about the 85 to 90% who have insurance. What I hear from my patients is not the access problem. I hear the expense problem. I hear people paying $1,000 a month or more sometimes for their insurance. I hear about the people who have no insurance because it is so expensive and they can't get it. I hear about people who have pre-existing conditions and can't get it. Or I hear about the portability problem that they wish they had it and could pay for it, but they're in between jobs and their insurance is tied to their employment and they don't like it. So I think the problem is an expense problem more than it is an access problem. How do we fix the expense problem? Why is it broken? You have to look at healthcare and say, what's wrong with healthcare and why is it different than every other facet of our economy? Well, some say, oh, well, it can't be like capitalism or it can't be like a marketplace because you can't negotiate for your heart attack price, when you go to the ER. Well, you can't, but 95% of healthcare is elective and done in a non-emergent fashion, and that you could. All of your routine daily care, you could be negotiating a price, but you don't. If we were to magically double the amount of doctors next week, double the amount of eye surgeons doing eye surgery, the price would not come down at all. Because most of eye surgery is people over 65, and I charge the same price as they do in Montana because the government sets the price. So the marketplace doesn't work. There is no supply and demand, and there is no reduction of prices based on people trying to compete for your business. There is no price competition. So when people say, oh, capitalism has failed us in healthcare and the private practice is not working, it is failing or it's not working perfectly, but it's because it's not capitalism. I have private ownership and I can make a profit, and that's good, but there is no price competition. Even if you come to me, about 55% of what I do is paid for by the government. About 40% is private insurance. So you come to me and you have Blue Cross, Humana, United, you still charge the same because I've made a deal with the insurance company, and so has everyone else in Lexington and Bowling Green. You don't make a decision to go to see your doctor based on price. Some people say, oh, you don't want to do that. It's different than Walmart or whatever. It's a little bit, but it's like a service, and services have quality, but they also should have a price component to it. If they did, we'd have competition. And people say, well, that never works. There are two things I do in my practice that people pay primarily cash for. The price has gone down every year for 15 years. Contact lenses, it's about $4 a contact in my office, almost the same as Walmart. Why? Because I have to compete. I don't want to be the same as Walmart. I wish I could charge as much. Everybody in business wishes you could charge whatever you want. You can't because there's competition. LASIK surgery, it's much more expensive, but people still pay cash for LASIK surgery, and the price has gone down every year for 15 years. Competition works. You need to figure out how to get competition and capitalism into healthcare. Well, this debate is almost like it's way over the head of anybody in Washington because they're not even having this debate. Their whole debate is how much government are we going to add to the system? I say the primary question you have to ask before you even get started is, what's wrong? Is it because we have too much capitalism or too little capitalism? Is it because we have too much government already or too little government? You have to start the debate at the beginning to decide which direction to go.